We all engage in some form of challenging behaviour to get our needs met. Let's imagine what happens if somebody cuts you up on the M25. Then we become challenging. What happens when you get a PPI call at 8:30 on a Saturday morning and you're just having a nice lie in? Let's say we just ignore that pile of washing up for long enough, maybe somebody else will do it. We all engage in behaviours of some sort to get our needs met. Dealing with challenging behaviour can be very difficult and unpleasant, and at its worst it can be dangerous both to the person and to yourself. So good forward planning can actually help to reduce the likelihood of challenging behaviour occurring in the first place, or at least make you better prepared in the event that it does happen. We need to determine the person's diagnosis. We need to look at the level of learning disability. We need to look at are there any additional mental health needs. For example, is your next learning disabled person that you meet also autistic? That could be a huge game changer. We should try to give the person and the relatives or carers as much notice as possible prior to the admission or the appointment that they're attending. We need to ensure that as much information as possible is being passed to them prior to the meeting with the patient. And we need to make sure that that's in a format that the person can actually understand. Some fast tracking through waiting rooms might be necessary. In fact, some people just simply cannot wait. So this needs to be a consideration before they arrive. We need to consult with family and carers before they arrive if possible, or at least on arrival. And if that's not possible, then we should be looking at as much documentation as is available for the person, care passports, and pay particular attention to any risk assessments that you might have. And certainly you should be carrying out your own risk assessment for any procedures that are likely to take place during the appointment. Another important document that we shouldn't forget is to read any positive behaviour support plans. And please do remember that your acute liaison nurse is always available to offer advice. There may be, for instance, physical health needs, so we need to consider the possibility of pain or discomfort in the person. There may be sensory issues, which can lead to some very unexpected responses to sounds, light, smells, for instance, and this needs to be considered. We should also look at any mental health issues that the person might have, and don't forget that they may actually be trying to get something that we're not aware of. This is a tangible gain of some sort. They can also be trying to escape, and I don't necessarily mean run away, but they could be trying to avoid a person, some demand that you've made on them, or some situation that they feel is threatening to themselves. And we should also remember that challenging behaviour very, very rarely occurs on a personal level, but quite often it does feel exactly like that. Your own safety and that of the person that you're dealing with is actually paramount, and you should make sure that you know where your safe exits are, have suitably trained staff available if at all possible. Be aware of your own body language. Try to present yourself as calm and non-confrontational as possible. We need to know, for instance, can the person tolerate direct eye contact? Does the person respond better perhaps to male or to female staff? Now it may be that the person that you're dealing with begins to display behaviours which puts themselves and or others at risk. This kind of situation might warrant physical intervention of some kind. We should remember that wherever possible, suitably trained personnel must be used to engage in this. In these situations, the least restrictive intervention must be used. The intervention must be fully documented. And more importantly, the intervention must be lawful. Please do remember, challenging behaviour happens for a reason.